Hi, I'm Dr. Lim Kang Yaik, Paediatrician at KPJ Selangor Specialist Hospital. Febrile seizures are seizures that occur when the child has fever. They typically occur in children aged between 6 months old to 5 years old. Majority of them happen during about the age of 12 to 18 months old. Febrile seizures are classified into two types: simple febrile seizures or complex febrile seizures. Simple febrile seizures are seizures that last less than 15 minutes. They affect the whole body, generalized in nature, and do not recur within the same fever period. On the other hand, complex febrile seizures are seizures that last longer, more than 15 minutes. They typically affect one part of the body, maybe for example an arm or a leg, or they recur again in the same fever episode. Febrile seizures are the most common seizure disorder in children. They affect about 3 to 5% of children below the age of 5 years old. Boys have an increased risk of getting febrile seizures. A study showed that 60% of children with febrile seizures were boys. Febrile seizures usually happen on the first day of illness when the body temperature starts to rise. During a seizure, the child may lose consciousness, they may roll their eyes backwards, and then the muscle starts to stiffen or even jerks. This episode usually lasts between few seconds to few minutes, and usually it will stop on their own. The child may appear sleepy after the seizure. Yes, febrile seizures occurs when the child has fever, usually when the body temperature rises more than 38 degrees Celsius. Usually this fever happens when the child has common childhood illness such as common cold, ear infection, or flu. First of all, stay calm, do not panic. Gently place the child on the floor and lie them on their side with their head tilted backwards to make sure the airway stays clear. Do not put anything into the mouth of the child because it may obstruct the airway. You do not need to restrain the child. Loosen any clothing around the neck and the head. Take note of the duration of the seizure and video it if possible so that you can show it to your doctor later. No, it may be alarming to witness a febrile seizure, but they are actually not harmful. They do not cause any brain damage. 30% of children who experience an episode of febrile seizures will have another episode of febrile seizure in the future. The risk is higher if the child has a family history of febrile seizure, if the first episode of seizure happened at a younger age, below 18 months old, or if the onset of seizure happened very shortly after the fever, or a relatively lower degree of fever during the first episode of seizure. Answer is no. We can give fever-lowering medications to lower their temperature to make the child more comfortable, but studies have shown that these do not prevent another episode of febrile seizure. And we do not recommend to give anti-epileptics, meaning medications to control seizure, for children with recurrent febrile seizures. Most children with simple febrile seizures do not go on to develop epilepsy. Epilepsy is a condition where a child has recurrent episodes of unprovoked seizures. Those children with neurological abnormalities such as cerebral palsy or delayed development, or those children with family history of epilepsy, do have an increased risk of developing epilepsy whether or not they have febrile seizures in the past. And those with complex febrile seizures have an increased risk of getting epilepsy. So, in summary, febrile seizures are relatively common, they are not harmful and do not cause brain damage. The important thing is we learn to provide appropriate first aid to the children when they have these seizures.
Sekiranya ada persoalan,
you can go to
our official website,
Facebook ataupun Instagram
KPJ Selangor
Specialist Hospital.